My name is Melissa Moore, and this is my 2020 Capstone project for the BSN RN program at Dixie State University. For my project, I sat down with my mentor and we brainstormed several ideas and decided that one that would be best for helping improve patient care and improve patient outcomes in our clinical setting in the ICU was to improve that care through IV pump cleaning and proper sanitization. To get this project going, again, I sat down with my mentor and we looked at the current situation. We saw that pumps were no longer being labeled as clean. Pumps would sometimes be left in rooms, removed from rooms, and so it was hard for nurses to know exactly which pumps had been cleaned and how much of them have been cleaned. Our hospital policy says that housekeeping will go in, and if a pump is left in the room, that they'll clean the outside of the channels or the brain of those pumps. But it is the nurse's responsibility to clean the inside of each pump after patient discharge. So we met with the nurses on our ICU unit and found that many of them did not know that this was our hospital policy. And beyond that, we decided that we would take it one step further and make cleaning the IV pumps the sole responsibility of the nurses on the unit, to ensure that it was being done in a uniform manner. My mentor and I sat down with our infectious control nurse as well as housekeeping to come up with a step-by-step process for sanitizing that our housekeeping team would be aware of, as well as the ICU nurses would have in each room to ensure that these steps were being done, as well as finding which supplies or which sanitation would be best to help us eliminate the infectious diseases that can often be found on high-touch surfaces, such as the IV pumps in hospital rooms. The reason I decided to do this project was to help improve our unit. So in order to do that, I needed to get a baseline of how many pumps, how many channels, and what our nursing staff knew and understood about the sanitization of the IV pumps. So I found that in the intensive care unit at the hospital where I work, we have 40 of the brains or the main control center of our Alaris pumps, and then 100 channels that can go to those. That helped me to develop the number of sanitation wipes, or how often we would be needing to exchange sprays with housekeeping, as well as just knowing how often we would be cleaning these pumps. I also did a survey with the nurses in the ICU to establish what they knew about our hospital policy of nurses being responsible for cleaning the inside of the pumps, and then sharing with them that we'd be changing this to them also having responsibility to clean the outside of these pumps and label them as clean when that was done. The purpose behind this, or the goals or benefits to our ICU, over the past several months, we have noticed an increase infection rate of our central lines that have been placed. My mentor and I met with our unit manager as well to discuss potential causes of our catheter central line bloodstream infection rate and why it was going up. My mentor and unit manager thought that putting this into motion may help decrease those numbers. We also wanted to unify our unit more, to be able to work as interdisciplinary teams with housekeeping our infectious control team, and as a unit as a whole. Picking my preceptor or mentor was fairly easy for me. I've been on my unit for a year now, and I picked a nurse that has inspired me to become better. I haven't always wanted to do ICU care, but watching this nurse and the way that she cares for her patients and the way that she applies hospital policy and has looked around the unit multiple times as we've discussed potential things, she's aware of improving patient care and how that can be accomplished on our unit. And so for me, it was an easy choice to pick her and follow her example and work with her as I took lead in a situation such as this, where we were improving the care of our IV pumps to help improve patient outcomes and decrease hospital-acquired infections. Which is one of the goals, the major goal of this project was to decrease hospital-acquired infections. From the research I did, it showed that there were 1/3 of all hospital-acquired infections can be found on IV pumps. I wanted to decrease that in our own unit. As I mentioned, we were seeing increases of central line bloodstream infections, as well as just peripheral lines seem to be getting infected and causing other problems, and we wanted to eliminate those. Another goal was just to make sure that our instructions were easily accessible to all the nurses, as this was going to be a big change for them. We wanted to have easy access to the instructions and easy access to the supplies that they were going to need. And we wanted to strengthen unity within the unit of our ICU. The overall analysis of this project was pretty straightforward. I was able to set a schedule and be able to meet most of those needs. The only complication, which I'm sure many of us had, was due to COVID-19. I had to push back meeting times with our infectious control nurse because she is extremely busy trying to keep each unit up to date on what the issues were. So meeting with her was a bit of a challenge, as well as our housekeeping. Everybody was just super busy, and we needed to find a time to make this work. But besides that, everything went as planned. I was able to march out date by date. I was able to sit down, create the rough draft of our step-by-step protocol of how we were going to clean our IV pumps. I was able to, again, sit with my mentor for several hours and have a rough draft and go to our final draft, be able to print it, laminate it, get our clean labels laminated as well. So those were easy to clean off after use. One of the other difficulties was prior to COVID-19, our hospital was going to switch from the Alaris pumps to the Bebron pumps, which didn't happen until the tail end of this project being in place. Just right before we were going to do our final swabs with our lab to see if we had in fact improved the infectious diseases, the bacteria that were being found on these pumps prior to the implementation of this project. So having to shuffle around things to swab the pumps a little early and then continue to make adjustments as needed for the new pumps. But with the help of my mentor, our unit manager, we were able to make those transitions relatively smoothly. It was very beneficial to me to see how to make adjustments for patient care because things don't always go as planned, and so having to switch and shift those things, we were able to do well with our adjustments from pump to pump. And grateful that lab was willing to help us out in this project to see the differences and to help provide data on our our central line bloodstream infections to help us in that data collection. The overall aspect of this activity, or the overall goals of decreasing our hospital-acquired infections and decreasing the amount of infectious diseases and bacteria that were found on these pumps, was successful. Again, thank you to our lab. They were able to take our swabs. They were able to provide data that showed the decrease in these numbers. We were able to see, again, the unity and the organization as nurses on the ICU of having that easy access to our supply units, to gather supplies, again, placing instructions in every room as a reminder upon patient discharge. Even when preparing rooms for patients being admitted, these signs are posted to help keep the nurses kind of on their feet and as a reminder to, hey, clean the pumps. Let's see what we can do to help control the infectious disease throughout our hospital. Being in the ICU, you want to limit those as much as we can, and we were starting to see that become less and less frequent of these diseases appearing, especially with our central lines, which we face and deal with quite often. This has helped me see the importance of leadership and unity in units. Like I mentioned earlier, ICU medicine wasn't always something I wanted to do. What I want to do actually handles very rarely with IV pumps, but the idea behind it of finding something in your unit, big or small, to start making those adjustments and help unifying each member of the team in that unit to get behind a common goal, has really strengthened my idea of leadership skills, of being forward and straight with those that I work with, and helping others to not only achieve a unit goal but individual goals. I saw nurses and spoke with nurses who were like, yeah, this is great, and they had goals to do that as well. Excuse me. So I look forward to being able to apply what I've learned from doing this project of following my preceptor's example, looking around the units that I'm going to work on in the future, including the one I'm currently on, and looking for ways to improve it, to improve the environment for the nurses, to improve the environment for the patients. I read in one of the studies that a major thing looked at by patients is cleanliness, and how often their rooms are being cleaned, and how often those high-touch areas are being cleaned. So being able to kind of gain an insight in that has really helped me in a professional standpoint, and will continue to guide my future decisions as a nurse. See, I think I covered that. To conclude, again, it was a wonderful project to be able to meet with interdisciplinary teams in the hospital, to work with each of them to become unified in setting in motion the plan to improve IV pump cleaning and care. We surveyed the nurses. A majority of them said that this was an excellent plan, and they felt that it was truly to help fulfill hospital policy. They did say it's a bit of an adjustment to have to do something different, but